right. I trust that all of you had engaging conversations. Who would like to report back first?
I'll go. So we don't all just sit here looking at each other. In terms of the first question about efforts and policies that we found successful in increasing access and willingness to get vaccinated, did we talk about one? Is it two? Really kind of the use of data in real time to make course correction. So if we saw that we weren't getting folks from a certain community or what have you, out making adjustment to access points, hours, outreach, and all that. And then really engaging in strategic outreach to particular communities to make sure so that you didn't have, someone used an example of there was a access point in Inglewood, but a lot of the folks that were coming there were not from that community. So how do you make sure that folks in Inglewood are able to access that point? And so really using strategic outreach with community-based organizations, faith-based organizations as a partner to recruit and engage their community members.
Thank you. Would anybody else like to report back?
Yeah, I'll report back for our group. So let me read my notes that Vic gave me. All right. We had a really great discussion. I think that one of the starting points was basically how one individual in our group was talking about how homelessness looks different block by block. So having flexibility has been really important. Hybrid access points have been important. Embedded access points have been important. Quality training efforts. Vaccine choices at events have helped empower people to make better decisions for themselves. So being staff designated to answer questions has also been successful. So a lot of clients don't have, since clients don't have any more information than what they get there. Let's see what else is there. Quality training. And then we had a primary care doctor talk about kind of like having that connection before and kind of set the groundwork to kind of have that person as a trusted person when they receive that information. So having conversation about the vaccine and maybe them being hesitant, but then kind of not just like a blank out no, but oh, I want to know more, and then taking that opportunity to kind of share that information and hopefully changing that decision that they make in terms of taking the vaccine. And lastly, sharing with people. So I think that folks shared how when folks basically take the vaccine, sharing their experience is kind of like this camaraderie effect, or it's like, oh, I did it, so you can do it. Has been able to kind of like sway folks because then it's like, oh, I'm talking from a lived experience of taking this vaccine. Yeah, and that's important. And then we briefly touched on too, which actually it was starting a really great conversation. The person mentioned how volunteering at these like kind of COVID vaccine events really gives you a new perspective and kind of brings up the issue or the point of like, how do we connect folks with these wraparound services while they're there? And then lastly, which I thought was very interesting, was how we talked about the faith-based community and how like within this pandemic, they've been hit hard. So starting to keep the lights on, like having ministers and pastors like do many funerals. And so we just got touched the surface of that. But yeah, that was an interesting conversation.
Thank you. So I will report back for our group. One of our folks asked let me start here. We talked about messaging and what that looks like for folks and how we navigate and the things that we learned from that. One of our folks said that he didn't see himself reflected within the messaging as a straight Black man, and that he didn't see very much of around, and he felt alienated within the messaging. There was another piece around a highlight or a mainstream focus on all of these demographics that maybe are not showing up as far as immigrant communities, African immigrant communities, as well as like the straight Black folks. And then specific messaging towards straight Black men. One of our folks pointed out that there was something like a flyer around Black folks, but then there was a white child on the flyer, so that didn't speak to him in the ways that should have been effective. And then someone else talked about circulating community information, like understanding that the resources that I spoke about earlier weren't known to a lot of the community. And so like circulating that information and making sure more communities know about the resources that are happening within their neighborhoods. And then one of our other folks talked about a template for a national response coming out of the response of COVID. So anyone else would like to share?
Sure, mine is fairly quick. We took a little while to get into our room, and then we did a round of introductions, which took a little bit of time. But one thing that was shared was, a couple of things were shared. One was the idea of, using more community health centers to address intersectionality. So for folks that are, from the LGBT community to immigrants to people that have several chronic illnesses, just making sure that we can get some wraparound services so folks are not having to go all around different places looking for those support services, and making sure that there's some support services involved that they can get referrals to. And then the other thing was for those folks that are in those intersectionalities that also practice religion or go to church and have faith systems, is connecting those in some sort of way. And so really making hubs of places where there's a market, a community center, and then a house of worship or a faith house for people to go to, and really trying to connect those things so that support systems seem seamless. And that was about as far as we've gotten. Joanna was our note taker and also our report back person if she wanted to add in anything. Otherwise, I think we can move on. Looks like we're good to go.
All right, and then I'm gonna hand this off to Brandon to finish this up.
You took over my job, Lucky. I was supposed to do the report back.
Sorry.
So I am going to hand it back to over for the closing remarks.
Okay. Great, thanks, Brandon. I think we were going to show 2 remaining slides.
Yeah.
It's probably not necessary. So in terms of, okay, here we go. So I think that this has been a really rich discussion, and I hope that everyone who stayed on throughout the entire time has enjoyed the discussion. Obviously we have a long way to go in the short term to increase vaccine access, but certainly longer term to address structural racism, which is driving most of what we're seeing. I wanted to personally thank our study team and everyone who's participated today in this presentation, as well as the other study team members. And I also wanted to thank the participants in the study, as well as all of you who are here today to hear the results. I'm also going to turn this to Laura, the principal investigator of the study, to give some final comments.
Yes, thank you. I don't have much to say except really a warm thank you to everybody. Really enjoyed the discussion, and really thank you for all of the insights today. And here are some acknowledgments, and the members of the study team, including all members of the study community advisory board, are listed here and their organizations. I wanted to mention that this was funded by gifts from RAND supporters, and also income from operations, as well as acknowledge a special thanks to CHIPTS, which put on this webinar and community discussion, and the people at CHIPTS who made this happen, especially Dami and Delara. Thank you so much, everybody.